Well, remember that was a debate. That was an academical debate, and I had the worst part of the debate, of course, the most difficult part to defend. But yeah, it is clear that Siponimod and anti-CD20, they do work much better in patients who have active disease. There is no doubt about that. But there are a number of aspects. One is that in many occasions, to identify relapses is not an easy task. So sometimes you think you are talking about relapses and they are just fluctuations on one hand or the other way around. So you just miss a number of relapses because you see the patient every, 6 months or every year, and you can miss some relapses on one hand. On the other hand, the MRI gives you a picture of that specific time point, but there's nothing for the last 12 months. So perhaps you're missing as well gut lesions. So the point is that in a number of patients who, you are not able to identify clear relapses, or you perform MRI and there is no gut lesions. If the patient is young enough and if the patient is progressing rapidly, I think you should make a try, and you should try anti-CD20 or Siponimod. The European guidelines, they're very clear when you have a patient with progressive disease and inflammatory activity, no doubt about that. And they recommend for patients with SPMS with evidence of inflammatory activity, which means relapses and or MRI activity, offer treatment with Siponimod. But also for patients with secondary progressive MS without evidence of inflammatory activity, but particularly in young patients and those in whom the progression has started recently, consider treatment with Siponimod or anti-CD20 as well. So you should discuss with the patient the pros and cons, you have to talk about the expectations, etc. But it's an option, even for the ECTRIMS, European Academy of Neurology guidelines. If you have a young patient with rapid progressive disease, even without clear inflammatory activity, you should offer those medications. And for PPMS, for instance, the European guidelines say that consider Ocrelizumab for patients with primary progressive MS, particularly, but this particularly, not only in early and active and clinically and or radiologically disease.